Thank you again for being here at the Summer 2021 DiabetesMine D-Data ExChange, where we track the present and the future of data-driven diabetes care. So we're excited now to unveil a study that's meant to serve as a barometer for where we are currently in 2021 with data-driven self-care and how the patient experience is being transformed as we move forward with digital tools and virtual visits. So DiabetesMine, working in collaboration with Drop and the patient community research firm Thrivable, set out to explore these two questions. Where are we now, and what needs improvement in the sphere of digital solutions in diabetes? From early April to early May 2021, we surveyed over 2,300 people with diabetes living in the United States. It was an internet-based survey on diabetes app use and virtual care. We had participants from all 50 states, and this graph shows the zip code frequency of our respondents. So the darker the area, the more participants per zip code. 100% of our participants had either type 1 or type 2 diabetes. It was nearly an equal split, 49% versus 51%. And the majority of participants identified as female, so 71% versus 29% male. Our participants indicated a high level of health literacy. So 86% were extremely confident or very confident in their ability to obtain, read, understand, and use healthcare information in order to make appropriate health decisions and follow instructions for treatment. Only 2% said they were not very confident. In terms of race and ethnicity demographics, full disclosure, the majority of our participants identified as white or Caucasian, so 78%. This was not intentional. It just reflects the patient population currently active on Thrivable's research panels, and we know that there is work going on to expand diversity in that community. As far as insurance status, the majority of our respondents said they had employer-provided insurance, which of course makes them very fortunate. Also, the majority reported an annual household income between $25,000 and nearly $75,000. So what did we learn? Well, we explored attitudes towards technology, common utilization of apps and tools, what these users find most valuable in those tools, and where they think there are gaps in current technology and unmet needs that still need to be addressed. So on attitude, the majority of our participants agree that health technology has a positive influence in managing their diabetes and their overall health. This includes telemedicine, apps, continuous glucose monitors, BGM, and other connected devices. So that was 88% who believe that technology has a positive impact on their diabetes management. And that actually represented 97% of our type 1 respondents. But overall, 1 in 4 said technology makes diabetes management easier. And of those who did not use apps, 1 in 5 reported just not knowing which tools may actually help with diabetes management and health the most. So 83% of our respondents said they use at least one health app regularly to help manage their diabetes. And of those, 36% said their healthcare provider actually views the data collected in that mobile app. But this 83% represents a significant growth. In fact, it's up 30% from a 2018 study that found only 52% of people were using a health app to manage their diabetes on a regular basis. That online survey included more than 1,600 people with both type 1 and type 2, and it also indicated that using health apps was positively associated with higher self-care behavior in people with both type 1 and type 2 diabetes. So it's pretty clear that COVID has spiked telehealth utilization across the board. And in our survey, 3 out of 4 participants had a virtual visit with their healthcare provider. Also, interestingly, in 2017, the German research firm Research to Guidance reported that out of the then 1,300 plus apps in the App Store, there was currently only about 1.2% utilization of the target group of people with diabetes. And they were then predicting market penetration would grow to about 7.8% by 2018. But today, that very same research firm is predicting that the digital diabetes care market will be worth $742 million by 2022. So we are definitely going places. And it may not surprise you that we found more frequent use of health apps reported among younger and more affluent people with diabetes. So there is the issue of age bias, and also technology reluctance among older generations. But what's frustrating here is that health apps are actually low cost and generally highly accessible. So that really means we have some work to do when it comes to increasing adoption among older individuals and those with lower annual household income. One issue is that healthcare providers tend to be more likely to recommend health apps to younger people. So we detected an inverse relationship between patient age and how likely their healthcare provider was to recommend a health app to them, and also frequency of app use. So what did our respondents call out as most valuable to them in all this digital tools? For the type 1s, it was straight up glucose tracking and data sharing. For our type 2s, glucose tracking was still important, but not as important as tracking weight, food, and blood pressure. And they made specific mention of things like food scale integration. But taken together overall, definitely data tracking, integration, and data sharing were the most valuable traits of these tools. And a full 85% of all of our respondents agreed that emotional support is a significant factor in optimizing their diabetes management. And most said they prefer interacting with a real person and the value of human interaction with the healthcare provider when it comes to emotional support. Regarding the tools, though, there were 4 big items on our participants' wish list. They want technology that is secure, affordable, easy to use, and integrated with other tools so that they don't have to juggle too many separate things. And when we say health technology here, we're referring to all of it: health apps, telemedicine, and other devices like CGMs and pumps. So on the flip side, our respondents felt that health technology is still being held back by a lack of integration, too much complexity, and lingering concerns over data privacy. That lack of integration with other apps, devices, and with health records in particular was specifically called out as a major disappointment and frustrating issue that hindered their desire to use health apps. In comments, we also had many people flagging the need to lower the cost barriers to CGM and other devices also. Particularly, they talked about opening up access to underinsured and uninsured and expanding CGM access to more people with type 2 diabetes. So a couple of share-worthy comments here. When asked what people wanted in health tools, they said simplicity, actual results, easy to stick with, little to no cost, recommended by my doctor. So this woman summed it up pretty well here. Another said, simple and brings everything together: blood glucose readings, easily add food and insulin from a list, activity tracker, blood pressure. And another who had actually also called out the ability to sort of record things all in one place also said, I want accurate information quickly. I would happily use an app if it offered a true closed loop system. So it's going to come as no surprise to this D-Data community that the emerging trends in this area are these. First, artificial intelligence, which of course can help with diagnoses. There are things like AI-based chatbots, and AI is now enabling predictive insights like glucose forecasts provided by OneDrop, for example. Expanding access to CGM, so we know that there's a huge potential market for lower cost CGM systems for type 2 diabetes, pre-diabetes, and beyond. And hyper-personalization, solutions, things like multi-condition health apps and user interfaces that will provide content tailored to your specific goals. And finally, last not least, focus on behavioral health. So that means addressing mental health issues that are associated with so many health conditions, and also finding paths to impact lasting behavior change. So we're going to be discussing these results with a panel of digital health experts in just a moment here at D-Data, June 2021. But we also wanted to let you know that a full report of these study results will be made available online on both the D-Data ExChange website and also at onedrop.today a little later this month. So keep your eyes out for that, and thank you.